My name is Olivier Gued. I'm the head of the oncodermatology unit at the dermatology department of the CHUV, that's the University Hospital in Lausanne. And my function here is to see that we give the best care to patients suffering from skin cancer. So we were looking for a system that would allow us to be to work as easily as a cell phone and WhatsApp would do, but which would do it securely and safely. And this is something that Imito lets us do, because once we take the picture, it's not stored on the iPhone, but it's put directly in our informatics system. Since we've used Imito, we've not lost a single image as we used to do before, and the transfer is immediate. That's also very useful when you have to transfer images rapidly. For example, if you want to organize a surgery, and now we have pictures that are available a few minutes or seconds after we've taken them, and before it used to take a week or two. So it really often happened that in the OP room we would lack the proper picture to know what needed to be operated, and this was also a serious problem. So we've gained a lot in terms of the facility of use of the system, and also the security of the system, and that's exactly what we wanted.